So we're cleaning the classroom, the gyms, the bathrooms, the staff areas, the teachers' lounge, office areas, um, and we also are cleaning our buses every day with this cleansing, in a hope that it will kind of slow down this virus. I know that CDD said that it's no cure to it, but we're asking the school district to be proactive and take that step of faith in trying to slow down this virus with our kids. You know, we don't want to be in a position where we have to shut down our school district throughout Texas because of we didn't take our action and responsibility in trying to slow it down. I'm going to call up each president from each local to come in and talk a little bit about what the unions are doing to trying to help fight this virus. And I'm going to ask my first union brother, Andy, from HFT.
Good morning. I'm HFT Executive Vice President Andy Dewey, and welcome. We already know that the virus is in the area, and it's likely to spread. The questions we have gotten from our employees, and HFT represents teachers, clerks, secretaries, paraprofessionals, teacher aides. The question we have gotten is, what happens if I can't go to work? The district's quick answer, and it's a reasonable answer, you use your sick days. Well, teachers have sick days? Some don't. What about the teacher who just came off maternity leave and exhausted it all? What's that teacher going to do? What about our hourly employees? What about our non-contract employees? What if they can't go to work? If I have one student in my class who tests positive for coronavirus, am I then forced to go on a 14-day quarantine along with every other student in that class, along with every other student in that school who may have been exposed as well? What happens if the school has to get shut down because of this ripple effect? If an employee can't go to work, even if they're fine, are they going to have to take their sick days? Does the district have a plan to deal with this situation if employees are not able to go to work, are not able to fulfill their duties, and they're told you can't go to work and it's got to be on you? Or you got to give up your money if you're an hourly employee. We won't let you go to work. What is the district policy on this situation? And right now, all we've heard is, well, they have to use their sick time. There's got to be a way to liberalize their leave policy to handle a situation just like this. Because truly, one positive test in one school can shut down that school if we think about everybody that child or adult has been in contact with in that school. And if you can't go to work, how can you be forced to go ahead and take your own personal time or give up your salary over this? So we're asking the district to come up with a comprehensive plan on how to handle leave for their employees in the case that they're unable to go to work due to this virus. Thank you.
I want to bring up my union sister from Fort Bend, Linda McCall.
My name is Glenda McCall. I'm the president of Fort Bend AFT. I represent 1,800 members, teachers, paraprofessional support staff at Fort Bend, Fort Bend ISD. Fort Bend was the first to identify a case in our area, and so because of that, there is great concern that it would spread to our employees and to our children. One of the cases actually is in my little small town of Stafford, which is a small community, and so we're even more concerned that it would spread because we are a close-knit community. I've taken action in that I have contacted the district, and our district actually has a pretty good policy as it relates to what they will do should a case be identified in our school district. But like my colleague Andy said, they have not addressed teachers that need to be out if the cases don't become so big that the TEA addresses it. Once it becomes a pandemic in the school, of course they will address it, and of course TEA has been pretty good about taking care of our teachers and our students in the district. But what happens before then? Like my colleague Andy said, if one case is identified in a school, then those teachers and all of those students around that one school are going to be forced to take their sick time and their sick leave. And if they don't have it, then they'll be out without pay. And so that is a concern that we continue to have for our teachers and our support staff. I was a teacher for 12 years in the district, and so I know that our teachers take precautions. We have always taken precautions in the classroom to protect our students and to protect ourselves against any kind of disease. So I'm pretty confident that our teachers have that under control, but this is a disease that we don't know very much about. We know how it spreads only by what the officials have told us, but we know that it is a scary deal to deal with. And so what we want to do, and what the district has done in their correspondence, is done some really good communications to our teachers and our employees and the parents about what to do. But we really want them to go a step further in this case and give our teachers some security, some support in being able to protect not only themselves but also our students. So we're hoping that the district will join us in collaborating in a good plan to protect our teachers in this situation. Thank you.
Thank you very much. That's our sister from Fort Bend. We're gonna ask next that Candace Houston come from A-Leaf. Aldine, I'm sorry, Aldine.
Good morning. My name is Candace Houston. I'm the president of Aldine American Federation of Teachers. I represent teachers, counselors, support staff, and paraprofessionals. Today I'm standing with my sister Retha and all of the other fellow presidents to discuss what is the district's plan to address when our staff has to go out on leave. Currently, our district on last Friday, March the 6th, our leadership team had a call with other districts and local authorities, and they came up with a plan. So the Chief of Communication Officer, Ms. Reed, did speak with me about what the district plan is. And it sounds like a good plan. I really liked it. They now have a website that's housing all of the information. So I do want to give you that website for Aldine. It is aldineisd.org/health alerts. However, my question to Ms. Reed was, how are we going to address if my support staff has to go out? Because they are hourly employees, and there really was not a plan. She just stated, TEA has to, declare, as Andy and Glenda stated, some type of disaster. But what happens if it is a standalone school? I am concerned because many of our support staff and teachers don't have the leave time, don't have the local time, they just don't have the time. And that is concerned because, of course, safety is always number one, okay? And I love the district's plan for the students. They have, just last Friday, they met with the nurses and head custodians, had an additional training to talk about making sure they're doing the extra cleaning. So like I stated, the district has a pretty good plan in place, but I did not really like the plan to address on the leave because there really wasn't a plan. So I'm really hoping that Dr. Goffney and her leadership team will be able to send me something in writing to address what is the plan if TEA does not declare it. We gotta have a backup plan. And that's what we're here for, to fight for the staff on the plan. Thank you for your time.
Thank you. Now I'm gonna ask my sister Shonda Below, come up from North Houston.
Good morning. Superintendent of Channelview ISD, Greg Ollis, Superintendent Dr. Angie Williams of Galena Park ISD, and Superintendent King Davis, Dr. King Davis from Sheldon ISD. I'm here today to let you know that this is not a drill. This is for real. The COVID-19 is at a pre-pandemic stage in our community. I am Shonda Bilo, and I'm president of Northeast Houston AFT, American Federation of Teachers, where I have over 900 members, teachers, counselors, diagnosticians, custodians, and paraprofessionals, as well as bus drivers. I'm here to make a statement on behalf of our students, members, district employees, parents, and the community. We know Channelview and Galena Park, Sheldon superintendents are leaving. We want to make sure they're leaving no stone unturned. We want to ensure that every bus, classroom, hallway, doorknob, and every restroom, cafeteria is disinfected on an ongoing basis. I would like to thank the Channelview, Galena Park, and Sheldon for already implementing the steps that they have taken so far. However, that is not enough. You have heard today that we want them to address issues and have a written plan on the proper procedures that will be used to disinfect our schools, as well as making sure that our employees of all three districts are paid if we have to close the schools now. Again, my name is Shonda Bilo.
Thank you, Shonda. We're gonna ask next our AFL-CIO junior brother to come up and speak. Hanny.
Good morning. My name is Hani Khalil, and I'm the Executive Director of the Texas Gulf Coast Area Labor Federation. We're a federation of 95 unions representing 60,000 union members across Texas Gulf Coast counties advocating for working families here. Today we're talking about the education sector and steps that ISDs can and have taken and need to take to make sure that our educators and all those working in our schools are protected from the danger of infection. I also want to talk about other occupations that are at risk of infection, increased risk that we need to worry about as well. Fact is, any working person interacting with the public is at risk. Working people are at increased risk if they frequently interact with individuals who are potentially infected or infected, and they include a broad range: healthcare workers, emergency responders, law enforcement, firefighters, EMTs, airline operations, pilots and flight attendants, for example, Customs and Border Protection and Transportation Security agents, correctional workers, cleaning workers, workers who have been identified as essential personnel by their employers during an outbreak or a quarantine, retail workers, food service workers, government employees at county tax offices or driver's license offices, and other workers with broad exposure to the public. Fact is, millions of workers in the United States are at risk right now are at increased risk of infection because of their broad interaction with the public, and potentially, therefore, with people who are infected. So what can we do? Fortunately, those of us who work in education, and I myself am a proud member of the Houston Federation of Teachers, we have unions, for the most part, here in the Houston region. We have unions who are advocating for us and all of us working in the schools. But that's not the case necessarily for a number of other workers who don't have access to paid sick leave policies. So I want to speak about that. The reality is, if you don't have paid sick leave, those who don't have it have a dilemma frequently. Should they stay at home without pay or go to work and risk infecting others? A 2017 Economic Policy Institute report estimated that for a worker without access to paid sick leave, lost wages associated with staying home amount to 3 days of pay. That would be frequently their entire month's grocery budget or their monthly utilities budget. It is a serious dilemma. We're talking about 33.6 million workers in the United States without paid sick leave, about 1/4 of our workforce, according to the Department of Labor. And so that means that without paid sick leave ordinances in place at the local level, because of the absence of that mandatory paid sick leave for the private sector, Many, many people across the state of Texas are at risk of getting infected and passing it to others. Here in Texas, San Antonio, Austin, and Dallas have all passed paid sick leave ordinances. But in all three cities, defenders of the wealthy have launched bogus attacks on those ordinances to block implementation. Here in Houston and in Harris County, we have not yet passed a paid sick leave ordinance. Now is the time. Let's not worry about the legal niceties. Let's not worry about people who are going to try to block this. We need to make sure every working person in the Houston region has access to paid sick leave, just like those of us who work in the education sector do. This is a life or death issue. It needs to be acted on. We need to make sure that those who get sick can stay home without worrying about loss of pay. And for those of us who can't wait for city and county government to move fast, let me also encourage you to do this: unionize. Those of us who have unions, first thing we do is advocate to make sure we get paid sick leave in a collective bargaining agreement or negotiate it with our ISDs, for instance. We need you to fight for paid sick leave to protect all of us. We want to support you in organizing a union. So if you're interested, call our office, 713-923-9473, or reach out to us at info@gcaflcio.org, or go to our website, gcaflcio.org. Thank you.
Thank you, Brother Haney. Now I'd like to call up our friend, our state representative, Ron. He's going to bring us a message from the state.
Good morning. Thank you, Aretha, for organizing this press conference. I'm State Representative Ron Reynolds from House District 27, and I stand here in solidarity with all of the presenters that have spoken today from organized labor. I am so proud of our educators who do so much for our state. Our state is vibrant because we have such strong educators. In order for us to continue to have an educated workforce, we have to have great teachers and paraprofessionals. I'm here today because I know that these individuals, as has been stated before, are very concerned about this epidemic. We have to make sure that protocols are in place so that our teachers are safe in the environment where there is a great likelihood that there can be transmission. We know that there's been confirmed cases in Fort Bend County. We know that there's been confirmed cases in Harris County. And so we want to make sure that all of the ISDs have protocols in place so that these professionals can be very comfortable and safe because health and safety should be our top priority. When these individuals go to work, they should feel that they're safe. Not only that, in the event that there is a quarantine, in the event that there is some type of outbreak, we do want to make sure that these individuals are paid. We know for a fact, even though during the last legislative session there was legislation passed for an increase in teacher pay, we know that teachers are still grossly underpaid. And we know that if they don't have the paid sick leave, that can be a severe economic hardship upon those families. And so we want to make sure that there is mechanisms in place with rainy day funds or whatever type of mechanism that needs to happen to make sure and ensure that for those families, in the event that they have to miss work, that they are paid. And so that is paramount. I've been in touch with the governor's office, Governor Abbott's office, and I've been assured that the resources from the state of Texas would be made available so that the citizens in Harris County and Fort Bend County or any county in the state that's impacted by the coronavirus is protected. Again, the state of Texas just last week received our first presumptive positive cases of the coronavirus, and we're going to do everything we can to ensure the safety of the citizens of Texas. It is very important that people who are sick, that they don't go to the emergency room, that they call their personal doctor first and they make provisions to get tested. That is first and foremost. Also, everybody can do a great job by practicing good oral hygiene and making sure that they are washing their hands, that they're using sanitizers, that they're covering their mouth when they cough. that they stay home if they believe that they have any kind of symptoms or they're sick. And so everybody needs to be on guard. Everybody needs to be alert. And we don't want anybody to panic, but we do know that this is a very serious disease. And so again, I stand here 100% in solidarity with these fine folks representing labor, representing AFT, and we want to make sure that when they make these sacrifices and they are there to educate and protect our children, that they're also protected.
Right.
We have to think about their needs as well. And so they are there to help our most precious commodity, our children, and we have to make sure that they're safe and secure. And so we're asking all of the independent school districts, the superintendents, the boards of trustees, to immediately implement a protocol to ensure that there is a viable plan in place, first of all, to protect their health and safety, and second of all, to make sure that in the event that any of them have to go out on leave, that they are compensated for that time. And I will continue to work with you, Retha, to make sure that the state of Texas stands strongly behind our AFT, our unions, our AFL-CIO, and all of these folks here represented at the table. Thank you.
Thank you, brother. As I said, that, you know, we just want to get this message out to the community that this is nothing to be playing with, and we want to echo what my brother said, that we need to come up with a plan. You know, and those drivers and those custodians that's having to clean the school, a lot of our school districts probably short of custodians, so they're the one going to have to be in front of cleaning this virus. You know, we ask that they give them some training. You know, it's cleaning the classroom regular is not the same way you clean for a disease like coronavirus. So we ask them to provide protective gear for these employees, gloves, hand sanitizer. You know, we can put hand sanitizer containers on the bus. When the kids get on the bus, they can have one of them on the wall, and the kid can, you know, mash it and get sanitizer as they sit in on the bus. And I think they just came to me, so I think that's a good idea that y'all may want to take back to your superintendent and ask them to put them on your school buses. Okay. We are open now for questions. Do you have any questions from anybody?
Are HIC schools currently being properly cleaned in your opinion?
I was told by the superintendent that they have started cleaning those schools properly. They're supposed to be starting cleaning the buses this weekend, and they order supplies. But we will be going out checking today.
Is that a process for every morning the buses are going to be cleaned, sanitized?
Yes, they're gonna clean those buses every day, sanitize them, in the classroom. I think that Shelby was the one had a report last week that they actually had those spray guns. They go in and spray the classroom, you know, clean them, and then still go in there and spray them with this like a weed eater sprayer to keep the virus to keep this virus down. This is a serious matter, and I hope that everybody in the sound of our voice today that y'all really take this serious. We don't want our kids to get sick or employees to get sick and then try to be reactive. This is one thing we need the school districts to be proactive. 'Cause I know in HISD, the other time, they are proactive, they are reactive after should have been proactive. So this is our message, and if you have a question for the others,
Rita, what is the plan for the teachers specifically?
I'm gonna let you speak on that.
Okay, and I'm asking this because we heard about a case of marriage, two teachers, the man and the female. Then they traveled to Italy, and then they went back to Houston. They came back, and then instead of being, isolated, they went to school, even considering that the HISD told them not to go to work.
Andy?
Well, that is the crux of the problem, isn't it? If they're feeling fine, they're probably gonna want to go to work. instead of burning up their sick time, instead of maybe having to stay home and pull their kids out too, all right, if they're feeling fine. If the district tells them to stay home, to me, that puts the onus of the financial responsibility on the district. If you won't let me go to work, how can you then dock me my leave time? All right? It's different if I take myself out. You have an argument for docking me my leave time. But if you won't let me go to work, it's up to the district to figure out how we're going to fund this. Because folks have to go to work. You gotta go to work to earn your living, even if you have some leave time. What if that example had been an hourly employee who was told not to go to work? They don't get paid that day. And so the district has to think ahead on this. Yeah, they went to Italy. A lot of people vacation, all right? You go all over the world, okay? You come back and you pick up your life as normal. It's nice if the district would ask us if we've traveled out of the country. We're happy to answer, unless, of course, we're told that we can't go to work and the entire financial responsibility is going to be on us. It is time for the district to step forward and say, we will find other sources of funding. Representative Reynolds mentioned the Texas Rainy Day Fund as a possibility, possibly federal funding that could be tapped into to do this. But just to stigmatize the person and say, you're gonna take this financial hit because we won't let you come in, is just flat out the wrong way of doing things. And if I may mention about the question that was asked of Retha, now is not the time for the district or the principals to scrimp on their budgets. They have to make sanitizing supplies available in the classrooms. There should be wipes, there should be disinfectant, there should be hand sanitizer in every single classroom. Every restroom needs to be stocked with toilet tissue and towels and soap. We actually got a report last week of a principal who was still making his teachers give the kids a roll of toilet tissue when they had to go to the restroom and then bring it back. Now, you can imagine how unsanitary that is? And the reason was because the kids wasted. All right? You know what? Now is not the time to pinch pennies on this. And so we are going into schools this week too, and the first place we're looking are in the restrooms to see if they're properly supplied. And we're gonna ask the district why they aren't. And it's not the custodian's fault. Custodians do what they're told, all right? This would be the fault of the building or upper level administration. Let's not pinch pennies on people's health.
Andy, what's your title again?
I'm the Executive Vice President of HFT,
Your whole name, sir?
Andrew Dewey.
Were any of your teachers not paid during Hurricane Harvey? And if they were all paid, why do you think this would be any different?
Well, that's a good question. Our teachers were paid if they had sick days, all right? Okay, they were paid. No, they were paid if they didn't have sick days either. We are concerned about hourly employees as well. And this may be a much larger scale than Hurricane Harvey. But you're right, Jacob, that we do have a precedent that the district has taken care of this in the past. But they have not told us it will be handled that way again in this case, all right? And we want the district to make that commitment that they are going to not penalize people if they are told to stay home and not come to work.
Were hourly workers also paid?
I'd have to double check on that. I am not certain. Rita, do you know?
They didn't get paid at the time the teachers got paid. They had to go back and vote on it to pay them. You know, left them about a week wondering whether they're gonna get paid. So they don't pay the support personnel as they do the teachers. They have to go and make a final decision on it.
But did they ultimately get paid for the amount of time that they would have worked if not for the disaster at the time?
Yes.
You said districts, someone said districts in Austin and Dallas have plans in place. Do you know what those look like?
No, we hadn't talked to our Austin affiliate.
From a strictly employee safety, student safety perspective, is there anything not being done right now that you think should be being done, not talking about salary, not talking about pay, but just safety.
Yeah, right now you have kids getting on the, until we bought this in, they had kids still getting on the school bus, wiping their nose, sitting down, and no sanitizer. We have custodians working at nighttime, cleaning with the regular disinfect, and hadn't been trained to use this Buckeye this Buckeye cleaners that they're using. We have them out there with no gloves. We have some out there who don't even have a protective measure on the cleanness. So you're putting a support personnel out front and making it jeopardizing their family. Yes. What if a bus driver gets sick? It's just an old bus driver. What if a custodian gets sick for clean up? It's just an old custodian. We need HID and everybody else to change this mentality of their employees. Everybody needs to be protected and be safe and be trained to deal with this virus that we're dealing with. It's not no play stuff no more. We get sick of play. Your kids ride the school bus, your grandkids ride the school bus, your kids go to HID. When you feel better, if you know that your kid getting on a bus, they have sanitizer, showing that the administration is trying to do something for our kids. When you feel better, if your kid going into a classroom, knowing the classroom have been cleaned properly for them to come in. This is a serious matter. We're not talking about, Jason, I want you to understand what I'm saying. It's not about the salary. That's going to be something going to happen anyhow because this coronavirus is taking over. And we got to quit sleeping. It's about keeping the community, our kids, from harm as much as possible. Nobody knows, and everybody's scared of the beyond, the unknown. And it's unknown to everybody. And then if you feel like if you're going to put a top on top of the bottle and keep it quiet and still send your kids to school, then you'll be foolish and keep thinking that. It's not going away. We have to do something.
At any of the other districts, are there any safety measures that are not being taken that you think should be taken in your district?
Well, we're currently on spring break, and we know that during spring break, people travel. I would like for the district to come up with a plan, how do we address, students who may have traveled? That needs to be a question. Currently in Aldine, we're on spring break. I would like to see the district have a plan together once we return Monday to address any staff and students that travel during spring break, because we may have an outbreak that come from wherever they travel. So we need to have a plan in place to address any travel that was done by our students and staff during spring break.
I represent Channelview, Galena Park, and Sheldon ISD. I did find out on Friday that Galena Park and Channelview requested that their employees let them know if they were leaving the country. However, I'm unsure if that was done and made an offer to our students as well. So I would like to have that addressed. And Sheldon, from my knowledge, did not ask their employees if they were traveling out of the country. So that's going to be a concern when we return to school on Monday morning, because we too are on spring break this week.
I represent Fort Bend AFT, and I know that at Fort Bend, the district put out a message that said that students would be afforded absence exemptions if they traveled out of the country or to an affected area, and the parents wanted to self-contain them at home. If they wanted to stay home, then they would be afforded the right to have their exemptions. So those absences wouldn't be counted against them. The teachers, however, were told that if they wanted to do the same, that they could, but they had to use their sick time. So this is one of the problems that we have, is that until the district has a plan in place for an actual pandemic and this whole school is out, those teachers who want to do the right thing are not going to be able to, because they're going to be forced to use their sick time. So that is a problem. The issue that you addressed is that if I go out of the country and I come back, am I going to self-quarantine? Because I have to use my sick time, and I'm not going to want to do that. And so I have to make the personal choice. Do I personally affect my resources for my family, or do I have the public's health in mind? Do I have to pick one or the other? And that's just not fair to our teachers, and it's not fair to our students or the public.
Rita, so what is the best thing to do, considering all the facts or the information that we have right now about the coronavirus? It's better for the school districts to
Be
cancel schools, or just to put more
well, let me say it like this.
measures?
Let me say it like this here. We're asking the school district to be proactive, not reactive. Because if it get to the point where it's get one kid or two kids sick in the elementary school, or one in the high school, or one in the middle school, then we're going to have no choice. They're going to close the schools down. They'll close the schools down. Because as long as they're not hearing nobody having it, everything's fine. But if they hear one thing, that one child that went out of the country and come back with a virus, then that's when it's going to hit the fan. We're just trying to be proactive before it hit the fan. At least let the community know that the school districts are stepping up, trying to do something. They'll not sleep. They know what's going on. We want them the community to know that these school districts are doing something, trying to put a curb to this this monster. That answer your question? Y'all had more questions for my sister? Speak Spanish.
For us? For telephone? Maybe later.
That's it. Thank you for coming.
Good catch.
That's right.
You were reactive.
That's all.